BAYOU Health is the name of Louisiana's new care system for Medicaid and LaCHIP recipients. During the first 6 months of 2012, our Medicaid and LaCHIP programs will move away from the current fee-for-service care system and into coordinated models of care. This conversion from our fee-for-service system to coordinated care includes 2 central processes. The first is the process of providers deciding which health plans they will join. The second is the process of Medicaid and LaCHIP recipients choosing one of 5 available health plans that will then be responsible for the coordination and delivery of their health care services. This presentation is focused on this second critical process, the health plan choice process for Medicaid and LaCHIP recipients. It was created because we know many of the recipients faced with health plan choice will reach out to their health care providers with relevant questions and concerns. This presentation covers these 8 items. We will begin by explaining the goal of BAYOU Health. Second, we will define the Medicaid and LaCHIP recipients that will be included and those that will be excluded from BAYOU Health. Next, we will review the list of service carve-outs. These are services excluded from BAYOU Health, which will continue to be provided through traditional Medicaid program. We will then show you a Louisiana map that defines the geographic boundaries and identifies the go-live dates for BAYOU Health implementation. The 5th item we will cover is a timeline of key steps in the recipient health plan choice process. We will then review DHH guidance to providers, some basic do's and don'ts related to the recipient health plan choice process. Lastly, we will point you to some additional resources that have been developed, including answers to provider frequently asked questions, and links to samples of recipient health plan choice materials, and some simple provider tools we have developed. Let's get started. BAYOU Health is committed to improving the health of our recipients by giving them the ability to choose their health care options. Several key elements are at the core of this mission. First, better quality of care and improved health outcomes through a focus on prevention, better coordination of care, interventions to actively manage chronic illnesses, and a comprehensive patient-centered medical home. Second, increased access to care, including enforceable time and distance requirements, negotiated rates with specialists, and the ability of the prepaid plans to contract with providers currently unwilling to enroll in Louisiana Medicaid. BAYOU Health will also extend benefits for our recipients, incentives for recipients who comply with care recommendations, and incentives for healthy behaviors. An important goal of BAYOU Health is to encourage recipients to actively participate in their own health and the health of their families. It is a message of empowerment that seeks to motivate people to make healthier choices for themselves and their families. This goal requires that our recipients have a real choice in their healthcare delivery system. Recipients will choose one of these 5 BAYOU Health plans: AmeriGroup, Community Health Solutions, LA Care, Louisiana Healthcare Connections, United Healthcare Community Plan. All 5 of these health plans will operate statewide. DHH is using 37 quality measures to track performance and will publicly post quality report cards for each health plan. Incentives and disincentives are tied to performance and to meeting quality goals. As you can see, 3 of these plans are prepaid plans. Each prepaid plan will have its own complete provider network, including primary care, specialty care, hospitals, and other providers. The 2 shared savings plans will have a primary care network only. For these 2 plans, specialty care, hospital, and other care will be provided by the specialists, hospitals, and other providers enrolled as Medicaid providers. Most, but not all, of the Medicaid and LaCHIP recipients will choose a health plan between December 2011 and May of 2012. In that short period of time, over 865,000 of Louisiana's current 1.2 million recipients will become part of BAYOU Health by choosing one of the 5 available health plans. Some recipients, about 40,000, will have the option to choose a health plan or keep their current Medicaid coverage, and some recipients are excluded from BAYOU Health at this time. A BAYOU Health plan choice is required for all of these recipient groups: Medicaid and LaCHIP recipients under age 19, parents of Medicaid recipients who are also under age 19, pregnant women except those enrolled in the LaCHIP program, and recipients who receive Medicaid because of age, disability, or blindness. A BAYOU Health Plan choice is optional for these recipients. They will be offered the opportunity to choose a BAYOU Health Plan, or they can choose to remain in the current Medicaid program. Children under the age of 19 who receive SSI or Family Opportunity Act, children under the age of 19 who are in foster care, children under the age of 19 who are in juvenile justice custody, children under the age 19 receiving services through the Office of Public Health's Children's Special Health Clinics, and Native Americans. These groups of recipients are excluded from BAYOU Health: residents of a long-term care or developmental disabilities facility, Medicare, Medicaid dual eligible, individuals enrolled in a home and community-based waiver, or age 3 through 20 and on waiting list for NOW or Children's Choice waiver, Louisiana Health Insurance Premium Payment LaCHIP participants, children in the LaCHIP Affordable Plan, recipients enrolled only for family planning services or the Greater New Orleans Primary Care Medicaid waiver known as GNOCHC. The following services will not be managed or reimbursed as part of the BAYOU Health program: pharmacy, dental, specialized behavioral health, all hospice, targeted case management, personal care services, children and adults, all nursing facility services, individual education plan, IEP services, billed through school districts. Most of these services will continue to be reimbursed in a fee-for-service environment through the state's Medicaid program. The exception is behavioral health. In 2012, DHH is initiating a new managed care model for specialized behavioral health services called the Louisiana Behavioral Health Partnership. Specialized behavioral health for Medicaid and LaCHIP enrollees will be managed by Magellan. DHH will implement the transition to BAYOU Health in 3 stages using Louisiana Geographical Service Areas, or GSAs, labeled GSA-A, GSA-B, and GSA-C. Please note that these 3 implementation stages are based upon the geographic addresses of the recipients and not the providers. This Louisiana map identifies the parishes and the DHH regions encompassed in each GSA. As you can see in purple, GSA-A combines DHH regions 1 and 9. GSA-A includes the New Orleans area, Plaquemines Parish, the North Shore area, and Livingston Parish. February 1, 2012 is the BAYOU Health go-live date for GSA-A. GSA-B is highlighted in red. As you can see, GSA-B combines DHH regions 2, 3, and 4. It includes the capital area, South Central Louisiana, and Acadiana. April 1, 2012 is the BAYOU Health go-live date for GSA-B. GSA-C is highlighted in blue. GSA-C combines DHH regions 5, 6, 7, and 8. It includes Southwest Louisiana, Central Louisiana, and North Louisiana. June 1, 2012 is the BAYOU Health go-live date for GSA-C. We have designed a carefully orchestrated set of steps to engage our Medicaid and LaCHIP recipients and encourage them to choose a BAYOU Health plan that best meets their needs. Let's review each of these key steps. The first key step is the Readiness Brochure. The Readiness Brochure is a 16-page brochure designed to alert Medicaid and LaCHIP recipients of the transition to BAYOU Health and the opportunity to select the health plan that best meets their needs. In the box on this slide, you can see the Readiness Brochure mail drop dates for each GSA. The second key step is Postcard number 1. This postcard encourages recipients to attend a meeting in their local area to learn more about the BAYOU Health Plan choice process and to receive health plan choice guidance. This postcard is customized for recipients. It lists local meeting dates, times, and locations. In the box on this slide, you can see the postcard number 1 mail drop dates for each GSA. We have developed a media campaign to deliver another alert to Medicaid and LaCHIP recipients, presenting a message of positive change for Medicaid LaCHIP recipients and directing them to be on the lookout for more information. In the box on this slide, you can see the media campaign start dates for each GSA. The next key step is the enrollment package. The enrollment packet, which includes the choice letter, urges enrollees to make a health plan choice now. The enrollment packet is a mailed package that includes comparative information on all 5 health plans. The packet also includes a description of all methods enrollees can use to choose a health plan, including by regular mail, telephone, internet, or local outreach meetings. In the box on this slide, you can see the enrollment package beginning mail drop dates for each GSA. The packets will be mailed out 5 different days over a 7 to 10 day period. Our outreach team will schedule and conduct over 120 local outreach meetings across the state to offer our Medicaid and LaCHIP recipients guidance that can help them select a BAYOU health plan that best meets their needs. In the box on this slide, you can see the recipient outreach meeting start dates for each GSA. The next step is postcard number 2. This postcard reminds Medicaid LaCHIP recipients who have not yet selected a health plan that their time is running out and informs them that a health plan will be chosen for them if they do not select a health plan. In the box on this slide, you can see the postcard number 2 mail drop dates for each GSA. We know from the experience of other states, not all recipients will take the opportunity to choose a health plan. In fact, most of them will not. The Medicaid and LaCHIP recipients who do not select a health plan will be assigned to a health plan by the Department of Health and Hospitals, DHH. Existing physician relationships will be considered in this auto-enrollment process. You can see the auto-enrollment start dates for each GSA in the box on the left. On the right side of this slide, you can see again the BAYOU Health go-live dates for the delivery of healthcare services through the health plans. For recipients in GSA A, the go-live date is February 1st, and for recipients in GSA B, it is April 1st. For recipients in GSA C, the go-live date is June 1st. Consistent with federal Medicaid regulations, recipients will choose a health plan with the support of an independent enrollment broker who has been hired by DHH to provide health plan choice assistance and guidance to the Medicaid and LaCHIP recipients. Providers are encouraged to identify for their patients the health plans that they have joined. However, providers are prohibited from recommending specific health plan choices to their patients. On the next 2 slides, we will review some more specific provider do's and don'ts. As we just explained, providers are encouraged to identify for your patients the names of all health plans you have joined. You can also explain the benefits and services offered to patients by all of the health plans you have joined. Providers may display health plan participation stickers in their offices for all of the health plans they have joined. And providers may also display or distribute health information materials for all health plans they have joined. These last 2 bullet items are very important. We ask providers to encourage your Medicaid and LaCHIP patients to attend a local outreach Choose Health meeting to learn more about their health plan choices. We also ask providers to encourage your Medicaid and LaCHIP patients to use the support services of the enrollment broker to choose a health plan that best meets their needs. In fairness to all of the BAYOU Health plans, providers must not identify for your patients the names of only some of the health plans you have joined, or explain the benefits and services offered to patients by only some of the health plans you have joined. Also, providers shall not display health plan participation stickers in your office for only some of the health plans you have joined, and display or distribute health information materials for only some of the health plans you have joined. Providers are under no obligation to display participation stickers or health plan marketing materials, but if you choose to display these materials, it must be done in a way that is fair to all of the health plans you have joined. Lastly, providers cannot recommend, encourage, or provide incentives for your patients to select one health plan over another. Providers cannot guide patients in their decision to select a health plan, other than letting them know which health plans you have joined. To help providers identify the BAYOU Health plans they have joined, we have developed the simple one-page tool that you can duplicate and hand out to your patients. It is simple to use. Just check the boxes that apply. Please notice that we have included the toll-free number of the enrollment broker that patients can call to get assistance and make their health plan choice. On the last 2 slides of this presentation, we will share with you how you can download this simple tool and other BAYOU Health provider resources. All of the information contained in this presentation is captured in a provider resource guide we developed for providers. This provider resource guide also includes answers to a list of frequently asked questions. The guide is available on DHH's Making Medicaid Better website. Click on the link here to download a copy. On the last page of the Provider Resource Guide, you will find thumbnail samples of all of the BAYOU Health Plan choice materials that have been developed for our Medicaid and LaCHIP recipients. To download copies, just click on the thumbnails. Again, you can download a copy of the Provider Resource Guide by clicking on the link here. Additional useful and downloadable information for providers can be found on the Making Medicaid Better website. Providers are urged to check this website often throughout the transition to BAYOU Health. New information is added often. Click on the link here to get to the Making Medicaid Better website. Also, DHH is conducting daily provider teleconferences to offer updates and address provider questions. Information about these provider teleconferences can also be found on the Making Medicaid Better website. Thank you.